The streets of Castries and public areas are eerily quiet this morning, Wednesday, the 1st of April, as St. Lucia commences its 7-day national shutdown. Hello and welcome to the studios of the Government Information Service. My name is Jessie Leonce. Thank you so much for joining us. If you went to sleep last night, you woke up and things seemed quiet and there wasn't much of a hustle and bustle in your community, it's not an April Fool's joke. The Prime Minister of St. Lucia, the Honorable Alan Chasney, has initiated the national shutdown in an effort to curb the rate of transmission of the coronavirus. We want to go back to last night when he made that announcement. He was with the Chief Medical Officer, Dr. Sharon Belmar-George. We want to go to a clip right now of the announcement that she made of the new cases here on island, which prompted this national shutdown.
Evening of Monday, March 30th, the laboratory director at the Ezra Long Lab diagnosed an additional 4 cases of COVID-19, bringing the total confirmed cases in St. Lucia to 13.
Yes, and at the press conference last night, the Prime Minister decided to shut down the country, take measures, tighter restrictions on St. Lucians to ensure that we would be safe.
As of 5 a.m. tomorrow, every person shall remain confined to their place of residence, inclusive of their personal yards. In essence, we're going to put into effect a 24-hour curfew. A person can only leave their place of residence upon written authorization by NEMO, inclusive of essential services. People are not permitted to go to the beach, go for a walk, or to visit their neighbor. People will only be allowed to leave their place of residence for medical emergencies. Supplies will be provided to the poor and vulnerable by NEMO, and police persons who need emergency supplies from NEMO can call 311 for assistance.
The Prime Minister, the Honorable Alan Chasney, there announcing the shutdown of the nation beginning this morning for the next 7 days so that we can reduce the rate of transmission. We can bring down the rate, the trends that are ongoing. Of course, the Ministry of Health is very concerned at the rate that things have been going in. Within a fortnight, we've had 13 cases. And so at the moment, I want to just now go to Dr. Sharon Belmar-George again with a clip on the rationale behind the shutdown.
This trend in confirmed cases is of concern. Apart from indicating that local transmission is established in St. Lucia, it also indicates that the required infection prevention measures are not being adhered to as recommended by the Ministry of Health and the World Health Organization. As the Ministry of Health, our urgent single priority at this point is to significantly slow down and contain community spread of this virus to protect the health and safety of every individual. As such, more drastic measures are now necessary to reduce the impact at this stage.
So there you have it, St. Lucia confirming 4 more COVID-19 cases, prompting a national shutdown beginning this morning. Chief Medical Officer Dr. Sharon Belmar there. We are joined in studio this morning by Ms. Natasha Lloyd-Felix, and she is the Director of the Bureau of Health Education at the Ministry of Health. Thank you so much for joining us.
Yes.
First of all, I want to talk about what the Prime Minister mentioned, calling the 311 hotline. Can you tell us a bit about why this hotline was created and how it can serve the public at the moment?
The 311 hotline was created as a means for persons to have easy access, quick access to information. It's really an information line, and it's also utilized to direct persons to the relevant services they may require, dependent on what they're calling about. We anticipated at some point we would have reached this juncture, the juncture where services would have been scaled down, access to offices would have been reduced, and we had to have a mechanism through which persons would be able to still have information and have it in a timely manner. So this line is really an information line in that you can get information pertinent to the virus itself. Persons who man that line have been trained with information on the virus. They have also been given information on how they can direct persons to services. So as you would know, we have established respiratory clinics around the island at 5 points, and these persons can direct persons accordingly. So if you call 311, what can happen is that you can indicate your need, where you live, and the nearest respiratory clinic as your point of contact. You'll be directed from that 311 call to a line at that clinic where you can have some sort of communication with persons on that end. Part of that is to reduce the movement and flow of persons, because as you know, the virus moves as people move. So if persons were to call, it reduces the risk of exposure, it reduces the risk of transmission. The other purpose we have it for as well is that we have a telemedicine or teletriage service with our physicians. So physicians have been given mobile phones, and with those phones they can actually do some preliminary assessments. The first layer of intervention by persons calling if they believe they're exposed or they believe they have symptoms which are of concern. By calling these numbers, they would be able to get services. So first you could call 311, indicate that you may be experiencing some symptoms of which you have some degree of concern, and 311 would then direct that call to one of the physicians in the database. And that physician will be able to do some level of assessment and determine whether you're to stay home and monitor, whether because of you being elderly or having a chronic illness and being symptomatic means you need to be referred to a respiratory clinic, or even escalated and then referred to a hospital facility.
Okay. Now, I understand that this same hotline has been inundated with calls,
yes,
and not for the reasons you just mentioned, I can imagine. Can you tell us about the services that NEMO currently offer for persons who may have been caught off guard, and provide guidelines for accessing this service?
Okay, so as of last night's announcement, one of the things that has been put in place for those persons who are vulnerable is the provision of care packages through NEMO. So NEMO would be the point at which these packages would be distributed to the community level through the district disaster committees. Persons have been instructed to indicate their need by using 311. So if you're in a community and you are someone, or you know of someone who has that vulnerability, has that need for a care package, which would be your essentials, food supplies, personal items, you are to call 311 to indicate the name of the person. And we're also asking for aliases, because in some communities, persons are better known by their alias.
Certainly.
So you give the person's name and their alias, you give an exact location, because if you were to call to just say Groseley, it doesn't say where in Groseley. So we're asking to be as exact as possible, and also to leave contact numbers. Once those care packages are put together within the next 24 to 48 hours, through the district disaster committees, distribution will take place. So right now, what 311 is doing is serving as a filter for us in terms of, first of all, having persons pass the information on to 311, and then they're going to collate and submit to us, and we pass on to NEMO. So the services of 311, though initially that was not the intention, we have seen an opportunity there where they can actually capture that data for us in a very quick manner and pass it on, so that we can respond to the need on the ground as soon as the services of NEMO become activated in terms of distribution of packages.
Okay. And whether they're calling because they have a genuine need, or they're just curious, many persons are saying that they're not getting through to the line. Can you comment on that?
Yes, I can. Actually, what has happened is that the lines have become very flooded, very inundated. So when agents are on the line, you find other calls are coming in, and that, of course, is going to slow down responses. Some of the things that have happened is either they get a busy tone, or they get no response. That is not because nobody is there. There are persons responding, but because the demand is greater than the capacity to respond to the demand, you find that the response is not what it typically is. Typically, there'll be a quick response by the team, but because the number of calls are coming in, and not only for the needs 311 typically serve, but also to respond to persons hearing there's a shutdown, where do I go to for certain things, I need medication, or I need supplies. So the calls have been across the board. It's a wide range of needs, and as a result of that, what has happened is that 311 gives us active reports in real time. So they feed it to us so that if we can troubleshoot whilst they address the need, we direct to the relevant person. So when they capture the call, they actually do take contact information and pass it to us. So if it's something we need to redirect or troubleshoot, we do that so that persons can have some of their needs addressed in the quickest possible time.
Understood. And I want to switch over to reinforcing the maintenance of social distancing. The Prime Minister chided the public, for many persons, for not complying to the act that is calling for persons to be cautious, to proceed with caution when dealing with other persons because this is a virus and so on. Can you reinforce the importance of maintaining social distancing, I mean, even in this shutdown?
I know social distancing is so new to our vocabulary, and COVID has come with so many new terms and words that I'm sure for many of us it can seem a little overwhelming, a little mind-boggling. But social distancing in essence is really an intervention to prevent too much contact that would cause us to have a high level of transmission of the virus. The virus doesn't move on its own. Somebody moves the virus, and it's us. It's like a vehicle. Somebody has to move it. That vehicle is us, the human being. By us limiting that movement, we limit the virus. It cuts the flow, or it mitigates, it slows it down. Now, you mentioned something when you started, where you said in the past 2 weeks we have had 13 cases. If we were to do some quick maths, it means almost 1 case a day. 1 case a day may seem small for some, but for us in public health is a big thing, because 1 case means you have a number of contacts. So if you, the human being, that vehicle moved quite a bit whilst you were symptomatic, or even before you had symptoms, the risk increases by your movement. The less you move, the less the risk. So the whole idea of social distancing is really to limit movement. And by limiting the individual's movement, you limit the virus's movement. What has happened, the fact that we have seen almost 1 case a day tells us that that social distancing didn't happen. That's all it tells us.
Well, we saw people cramped up in queues at the bank. We saw people crowding supermarkets. Yes. I mean, it really essentially caused a panic, the fact that you had this non-essential services closure and so on. So can you comment on that dynamic as well?
Well, exactly. What we thought would have happened didn't obtain.
Okay.
Yes? So we expected that, given the context of what was happening, we had visuals from other countries, that we'd have seen the merit in it, and also knowing that our country's resources really cannot match what we see happening in other countries that are much more resourced than us. The fact that we are seeing the numbers that are there, and now we're seeing that there's no travel associated with that, tells us that social distancing is even more important now. When we got pictures and images of what was happening at various institutions that people normally go to, the banks, the supermarkets, bus stops, it was alarming for us. It may seem a little abnormal and away from the norm for the average person, but for us, we knew what risk that posed. The challenge we have with COVID, unlike maybe a hurricane, it's something you see, and we respond to visuals. So you could see the damage. You can see what's happening out there. With it, it's almost like something that's silent, and it may seem as if it doesn't exist. But the numbers tell us that it's real, though it's not something that the naked eye can see. The figures we are getting is telling us quite a bit. It's a different story, and it tells us that somebody's moving that virus. So we had to find a way of stopping the congregation of persons. The first thing you do is appeal to persons' hearts and heads, and we did a lot of that. We appeal to people's hearts, we appeal to people's heads. But sometimes that's not enough. And though we do not want to be more stringent, there are times where stringent measures are necessary, and I think we are at that point, because our health services will become overwhelmed, and we know the whole idea is to reduce that overwhelming, what everybody calls flattening the curve. Flattening the curve simply means you don't want too many people coming in and we cannot match their need. Because if we can't match the need, the outcomes, the health outcomes become worse. So the less people you have transmitting and moving that virus, the less human beings transporting that virus, means the less likelihood that the health system would be responding to an overwhelming number of persons coming in. It doesn't mean there'll be no cases. It just means you significantly reduce it to a point that you can manage it effectively, that the loss of life that we are seeing doesn't take place, that the health outcomes are more positive, that persons can recoup in a quicker period of time, and that way our healthcare system and the persons providing the service are not overwhelmed.
I want to go back to the 311 hotline, but in the meantime, if the engineers could just line up the report on maintaining social distancing. The 311, can you tell me about the reception you've been receiving in terms of persons calling to get information? How much do people know about COVID-19?
So when 311 just started, what we found people called a lot about is COVID 101. What is it? How is it spread? How do I prevent the spread? And a lot of it was reinforcing messages that were already out there. So what 311 really did was give a chance to have a dual conversation, because when you message and you send it out is one directional. You just give a message. When people get a chance to clarify and ask questions, it really helps in cementing that message. So 311 did a really good job with that for us, and what we found is that the demand on us at the ministry lessened. But in addition to that, what we have also noticed is that the questions have since changed. Okay. So as our national response changed, the questions posed to the teams at 311 also changed to match. And so 311 is actually serving as a point of clarification, a point of reinforcement, and getting people more aligned and more on board with what is happening at the state level. So the communication that is given at state level, you find that it's now being able to be clarified. Persons are able to address their specific needs in the context of a policy situation by the state. So you will say, okay, I heard that Nemo is now going to be distributed in packages. I am a single mother with a baby with no food supplies, etc., etc. How does that serve my purpose? And then with that, we can direct accordingly.
Okay, and we're going to take you to a report we have packaged on maintaining social distancing. Social distancing has proven a challenge for many members of the public, despite the very real threat of contracting a deadly virus. Since the outbreak of COVID-19 and the declared state of emergency, many joined cramped queues at banks, crowded supermarkets, and continued to socialize in public spaces. The Environmental Health Department is admonishing the public to obey the law and practice social distancing at this time. Physical distancing protocols of the Emergency Powers Act orders services, government agencies, and essential services to ensure that all customers and staff maintain physical distancing of no less than 6 feet in the business or office, or outside the business or office. It also orders such entities to, if required, determine the number of persons that may be permitted in the office at any one time by permitting one person for every 30 square feet of space.
We have observed that in practice, the recommended 6 feet distance is not being maintained, especially when persons queue for service at institutions and business places such as supermarkets, banks, etc. To this end, we wish to implore the public to adhere to those measures. By maintaining the recommended 6 feet distance, you reduce the likelihood of getting infected or spreading the virus when people around you may cough, sneeze, or make physical contact.
She further advises that persons make limited trips to the supermarket and other places of business and avoid getting together in groups. Instances of breached containment efforts in the public domain forced the hand of the Prime Minister to announce tighter restrictions on Sunday. He chided offenders during the press conference.
We have not done a good job of making sure that we're all doing the right things. I mean, the government has made the resources, has put all of the laws in place, has increased the number of policemen out in the field, but many of us have just refused to adhere. There's still examples of people going to bars. There's still examples of people going in crowds to the beaches. There are many operations that have continued to operate, flaunting what was required by the government. So this afternoon I have to announce that we are going to have to put more stringent regulations in place.
In the briefing to announce the 5 new cases of COVID-19, Prime Minister Chasney announced an extension of the partial scale-down of non-essential economic and social activities to April 14th, an extension of the curfew now from 8 p.m. to 5 a.m., and the suspension of liquor licenses island-wide. For the Government Information Service, I am Jessie Leonce. You may notice that myself and my interviewee were a bit further apart. Some persons had a concern that we were not socially distancing. So we are now.
Yes, we are.
I just want to make a call out to the general public to have patience with the hotline. A number of persons are calling, and we've used the word earlier, inundated. The line is inundated with persons calling to find out if they could get supplies for their home. Many of you were perhaps caught off guard, and so we want to be able to provide the service for you. The Ministry of Health wants to do that. NEMO wants to do that, but they are inundated with calls, right, Natasha?
Yes, the flow of calls, it's very, very heavy, and we will be responding to needs. But what's important at this point is that persons realize that the team is functioning, they are on calls, and they are responding. There just may be a slight delay in the response to your specific call.
Okay, so we're just now wrapping up with Mrs. Natasha Lloyd-Felix, the Director of the Bureau of Health Education here in St. Lucia. You have any final words?
Yes, so we really want to encourage the public to support us, to realize the importance of what's happening. What we're doing here is really to protect the health and the safety of every single individual. We know it's different from the norm, but it's very necessary, it's very needed, because the numbers that we're seeing, we would not like to see it multiply at the rate we are seeing in other countries. At this point, we know that there may be persons who would like to know how services can be accessed. The health sector is an essential service, and so as a result of that, our wellness centers function. Particularly in the context of COVID, our respiratory clinics as an access point, they continue to function. And so just to let persons know that the Grosley Polyclinic is open from 8 a.m. to midnight as a flu clinic. The Leclerc Wellness Center from 8 a.m. to 4 p.m. The Denry Hospital provides a 24-hour service. The Viewfort Wellness Center from 8 a.m. to 4 p.m. The Soufrière Hospital provides a 24-hour service. These are 5 focal areas where we deliver respiratory care to persons who may be presenting with concerns or symptoms of respiratory illness. In addition to that, we want to let persons know if you are coming in with a respiratory concern particular to COVID, when you do come, we are asking that you go directly to a healthcare provider. That when you go to that healthcare provider, indicate your concern rather than sitting with the rest of the clients in that facility, and it will be attended to. Also, if you were to desire services of a physician through our tele-triage service, where you can call to indicate your need, you could call, the option is to call 311, or even better, we have provided our various media houses with the list of numbers. It's also going to be placed on social media platforms that you can directly call the numbers listed for that service, where you can have a first layer of assessment, and through that assessment you can be directed accordingly. It may mean if it's mild and you're not among the high-risk group, you'd be asked to stay at home and monitor the situation. If, however, you are somebody who has additional risk factors, then you would be asked to access services which that physician would direct you to.
Thank you very much, Mrs. Natasha Lloyd-Felix. She is the Director of the Bureau of Health Education here in St. Lucia, bringing us an update as to the situation at NEMO, the Ministry of Health, today, one day into the national shutdown. Do stay tuned. We have more news. We have a packed schedule coming up. We have a notice for farmers to contact the Ministry of Agriculture for export arrangements. Do stay tuned.
It's power bike time!
Oi, you need to cover your mouth. Don't you know about the coronavirus?
It's not a joke, it's a serious thing.
True that. What's coronavirus anyway?
The coronavirus is a group of viruses that causes the common cold. In more severe cases, it's like the flu.
Really? So are you saying that this is not a new virus?
No, it isn't new. It's a new strain. That's why some people say novel coronavirus. Yes, look at it like a family who just had a new baby.
I get it now. So how is it spread?
Through the air, like coughing and sneezing, touching objects, surfaces with the virus on it, touching your face, your eyes, your nose, your mouth before washing your hands with running water and soap.
Sounds like someone has the flu or the cold. Are the symptoms the same?
The symptoms are fever, coughing, sneezing, headaches, just like the flu. In some severe cases, you also have breathing difficulties and chest pains. Some persons also get pneumonia and kidney failure, and as you have heard the news, some people have died.
Wow. So how do I protect myself?
We have always been told to wash our hands with running water and soap. In the event there is no running water and soap, you use an alcohol-based hand sanitizer of at least 70% alcohol. Try your best to avoid touching your eyes, your nose, and your mouth. And in the event you need to sneeze and cough into a tissue, you throw the tissue into a bin. If you do not have tissue and you need to sneeze or cough, you do it into your elbow.
Yes, I heard that. So what medications can we take?
Well, as the virus is new, there is no medication or vaccine that you could really take to prevent it. What we really have to do is to practice infection control measures to protect ourselves.
Hey, people. I need to get a sweat. Let's get moving.
Let's do it, guys.
So, wait, how do I get more information?
Good, I have that number on lockpad. For further information, contact the Bureau of Health Education at 468-5349, 468-5347, or 468-5342. Let's defy limits!
Woohoo! Come on!
Welcome back. You are watching the COVID-19 response here at the command center of the studios of the Government Information Service. My name is Jessie Leonce. If you're just joining us, a special welcome to you. I am joined in studio. Well, before I get to that, if you're just joining, I just spoke to Mrs. Natasha Lloyd-Felix, the Director of the Bureau of Health Education from the Ministry of Health and Wellness, and she just provided us with an update on the 311 hotline, as well as the maintaining social distancing. You see, we are now wider. My new interviewee, maintaining social distancing and just providing general information about the ongoing efforts of a little bit of NEMO as well as the Ministry of Health and Wellness on island. We now move to agriculture. Many sectors are being affected right now by the national shutdown. Sectors were being affected by the partial scale down of non-essential services on the island, and right now we want to focus and zoom in on agriculture. I'm joined by the Minister for Agriculture, Fisheries, Natural Resources and Cooperatives, the Honorable Ezechiel Joseph. Good morning, sir.
Good morning to you and good morning to our listeners, and I'm happy to be here to give an update as to what we are doing in the Ministry of Agriculture, what we're doing as a government to give support to our farmers under the conditions that we are facing right now.
Okay. Can you just give us an understanding of what's the impact that a national shutdown of this magnitude would have on an agricultural sector?
Okay, of course, one have to understand that our farmers are the ones providing our respective entities with food. One of our biggest market is the tourism industry. The tourism industry is very critical as it pertains to giving support to our farmers buying the local produce. Now we see this shutdown with all the major supermarkets. So as it pertains to a reliable market in these entities is very critical, and it will definitely have some negative impact on our our farmers. In fact, this morning we got calls as to a number of farmers who harvested based on a request that was made yesterday, and unfortunately because of the shutdown, these supermarkets are not open, and the farmers now are stuck with the produce, which I'll speak to in a while as to what we are putting in place to accommodate these farmers. But definitely, with a reduction in market access, the availability of market, it will definitely impact our farmers. Considering that this year we started with what we describe as a 7-crop program, and the 7-crop program, critical for us as far as the market link, was the tourism industry. And the cultivation at the ground level, the acreages that we were targeting, we were considering supplying to our respective hotels based on the commitment that they had given us. And that is very detrimental to the programs that we are having. But we are optimistic that we will be in a position to assist our farmers in marketing under the present conditions.
Okay, before we get into the meat of things, I want to ask, where does a farmer fit into the national shutdown in terms of the emergency powers, the restrictions, and so on? Do they still go on their farms? What happens? Well,
that's why I'm here with you, and I was in Jukba this morning to really educate our farmers as to what are the options. You would remember when we discussed the initial shutdown from 11 to 5 in the morning, the Honorable Prime Minister, on both occasions, both the 11 to 5 and the 8 to 5 shutdown, did made mention that it's critical for us that our farmers still be given access to their farms, because food security is critical as far as production is concerned. We're still of that mindset. Whilst last night the Prime Minister did not mention in his address, but of course we are under the impression that the mere fact that it was done twice before, farmers should be under the impression that they are considered as far as what we describe as an essential service. So we have been getting a lot of calls from our farmers as to what is happening to them, and I had the opportunity to speak to them this morning, and I'm going to speak to them again. One pertains to the fishermen. What we learned last night was that after the announcement of the Prime Minister, there were a number of fisher folks that went out and came in late yesterday evening, last night, and the intention was to go and sell their fish today, right? But the mere fact that the lockdown came on board, that has affected them. What we have agreed as a government, that those persons who are in possession of fish on ice, they have the opportunity to go around today to sell their fish. All right? I already spoken to the Commissioner of Police, I spoke to the Prime Minister, I spoke with Nemo, and we all have agreed that these individuals can go around and sell their fish. Of course, keeping the protocol of not more than 9 persons around the vessel that they are selling. Okay? And the social distancing protocol. Now, we have said that in a situation as far as the fishermen are concerned, we are not going to allow any fishermen to go to sea as of today, until we have come out of the 7 days lockdown. So which means that we are expecting fishermen to stay on shore. All right? So, and I don't say that in part if you allow me to, because it's important. Les pour pêcher, gouvernement a pris une décision dans ces pêcheurs qui ont tué hier soir et puis poisson, et puis ces poissons ça sous la glace, et puis nous savons market là pas ouvert pour ça vendre. Based on discussion et puis président Goodwill Fishermen's Cooperative of V4, gouvernement a d'accord pour ces pêcheurs ça aller au pays pour vendre poisson yonia sous la glace. But of course, you need pour d'accord that les cas vendre poisson ça, you need pour chain ça quoi que protocole là pour pas ne plus passer 10 moun en machine yo. Et puis you need pour ni ça quoi que social distancing ça moun pas ne venir top pour yon l'autre. Nous va parler avec ces police là et ces police là d'accord that you can accommoder ces pêcheurs ça, but ces moun ça ne pour vier home pour 4 heures l'après-midi ça. So you need up to 4 heures après-midi pour ça continuer qu'à vendre poisson et puis ça vier home yo. Nous also dit that nous pas d'accord pour pièces pêcheurs either from Georgia. Tout le temps nous pas fini à faire protocole là et puis shutdown là. OK?
See your power weapon.
soon.
Si yo pa wepon.
Si yo pa wepon, si yo pa d'accord pour situation, ou then policeman wè kay deliver yo.
Ah oui.
Alright, because nous policeman wè do wè, nous ka hope that you nous pa kay une situation, you pa kay d'accord pour situation ça. Parce que wè do ou pa kay ni permission pour aller ou un pays pour vendre, comme on a fait aujourd'hui c'est dernière fois you kay ni pour permission pour aller pour vendre, et puis toutes ces places là fermées. So all our major supermarkets and of course the Ocean Blue Seafood, I'm always mistaking that name, but the company now managing the St. Lucia Fish Marketing Corporation is closed. So which means the respective outlets for our fishermen is not readily available. So I just want to say, so that is as it pertains to our fishermen.
So it's futile to go out.
It doesn't make no sense to go out, okay? Because you risk being arrested by the Marine Police. So I'm hoping that the fishermen can understand that. And based on discussions I had last night with the president of the Goodwill Fishermen's Cooperative, she understood and she commit support based on that decision of government, that policy decision of government. As it pertains to farmers now, a lot of farmers calling, oh, well, I have my animals to go and see and I have this. But come on, I mean, as a government, we understand an animal can't stay 7 days without being taken care of, all right? So we have agreed that our livestock farmers that have the pen away from the home, because we have livestock farmers who live on the farm, okay? Our livestock farmers who have the pen away from the home would be given permission to go on the pen, all right? Of course, they have to get a written approval from a written letter from our PS, and that will be done through the extension officer. So on that letter, we would have the farmer's name, the vehicle that the farmer is driving, okay, where the farmer has his or her pen, all right, what type of livestock that he or she is rearing, all right, and of course the time frame in which they will be allowed to operate, up to 4 o'clock every afternoon for the 7 days, okay. So as far as the livestock farmers are concerned, we are taking care of that. Then we have the crop farmers. Again, the crop farmers have to go and irrigate. All right, and in some instances there might be need for them to go and harvest based on our request from the Ministry of Agriculture. These farmers are being given permission to go on the farm. Now, what we are saying as of today, they can operate without the legal instrument coming from the PS, if you understand what I'm saying, because of the suddenness in the decision. But by tomorrow afternoon and for the remainder of the period when we have the complete shutdown, we're expecting all farmers who are interested in getting that written document would make themselves available to contact the extension officer to get it. So the onus is on them to be able to capitalize on the opportunity. Now, I was told this morning, when I left Juba, that there are a number of farmers, one, our banana farmers, because today is a banana day. All right, so we have farmers harvesting. Based on discussions with the Commissioner of Police, these farmers will be allowed to continue harvesting. Okay, and also now I want to make a new announcement, which I have not made before, where we are aware, like I said earlier, that there are certain farmers who harvested yesterday with the intention of selling this morning to major supermarkets, and because of the closure, they are not in a position to sell. We in the ministry have discussed it, and we have agreed to open the St. Lucia Marketing Board, right, facility in cul-de-sac, right, where these farmers between 1 to 4 o'clock this afternoon, where these farmers can now be given an opportunity to sell the produce that they have harvested.
Sell it to whom?
To St. Lucia Marketing Board.
To St. Lucia Marketing Board. Understood.
Because St. Lucia Marketing Board now is responsible to supply food to the respective institutions that we are providing cook meals to. So at least we can utilize the local produce to supply these institutions, so at least the farmers can have a market. So mostly did that, c'est farmers là qui a harvested, qui produit hier pour vendre by supermarket là, et puis supermarket là fermé. Marketing board qui a ouvert après-midi from yonder pour 4 heures, que farmers qui a harvest produit, ça est vendu by marketing board, et puis marketing board qui a acheté ces produits à yoni. Depuis, c'est bonne qualité. Good quality is important to emphasize.
Understood.
Yeah.
I now want to move to export.
Okay.
this business has not been halted amid this shutdown. Can you give us some more information as to the arrangements which have been made for the export of our products?
Well, if those persons are involved in export, the critical aspect for them would be the question of shipping. And we know the ports are not closed. All right, we have already said that the ports are remaining open, both for exporting and for importing of products. So it's for them now to get the legal requirements, the legal documents from the Ministry of Agriculture, informing us that when they intend to go around purchasing from our farmers, and of course they will be accommodated. But to me, the critical aspect is not a matter of purchasing, it's how they export the produce that they have purchased from the farmers to the respective destinations that they are looking at. So yes, to answer you, provisions have been made for those exporters.
Okay, yeah. And how can they go about? What do? Do they call the ministry?
Well, they call the PS. They call the PS, or they call the DS or the Deputy Director of Agricultural Services. They would have the contacts, and they will be accommodated. And of course, it's understood whilst we are given the letter of approval for them to be able to move around, we're also going to officially inform NEMO that these are the individuals we have given permission based on a cabinet agreement.
Understood. Yeah. I now want to switch to the water situation here in St. Lucia with Wasco and persons being concerned that again, with the suddenness of this decision made by cabinet, that perhaps they may be subject to perhaps losing their water supply. Some persons may be, there are several concerns surrounding Wasco. I want to go to a clip of the Prime Minister making a statement on Wasco. If we could just go to that clip.
Minister, you ask a quick question. Farmers want to...
We're working with the utility companies. I've indicated that Wasco has already indicated that anyone who was disconnected can get reconnected for free, and that you can be assured within the next 3 months that no one is going to be terminated. My conversations with Lloyd-Felix continue, and my understanding is that it's going to a board meeting tomorrow, and that we'll be able to announce the package that Lloyd-Felix is going to be able to provide to the general public.
So the government of St. Lucia has worked very assiduously to ensure that the people of St. Lucia are not inconvenienced too much by this national shutdown, and this includes a dialogue with Wasco, not shutting down, free reconnections first of all,
that's right.
And the disconnection, free reconnections and no disconnections for
that's
3
right.
months. Can you speak on the significance of this decision and this agreement between Wasco and the government of St. Lucia?
Well, yes, I mean, as a government, I support that decision wholeheartedly, and I'm happy that the management and board of Wasco understand and appreciate what we are doing and working along with us as a government to accommodate our citizens. Because when you speak about the hygiene aspect and the control of the coronavirus, water is critical. And we believe that there's need for us to be compassionate and to give support to our St. Lucians. So I'm happy that based on discussions we have had with the board and management of Wasco, they are on board. And not only Wasco, but I'm sure I can speak for Lucia, but based on information that I have, Lucia is another
spending.
Another entity that has come on board. And of course, we're working as a team. And for us to overcome the challenge that we are faced with, there must be collaboration, there must be understanding, and of course there must be sacrifice. And what I'm hearing there today is on persons' input as to government took that decision too hastily. I mean, the reality is, whenever you take it, people will complain. I think what we need to do now is to listen to the concerns that are being expressed, like I spoke of in case of agriculture, and see how we can, within today and tomorrow, to overcome these challenges and to give people that level of comfort. But in the reality is, whatever decision you take, there would be people that will complain. There are genuine complaints, and we have to take on board the genuine complaints, because in every decision you have to listen to the people. So as a government, I have no problems with the decision that we have taken. It's the first time we are going through that experience. It's a learning experience for us, but of course people have to understand that there need to be a whole level of sacrifice. Sacrifice is important, commitment is important. It's only for 7 days. It's better we take that tough decision now than to have persons lining up on the hospital bed or lining up in hospital and they can't be accommodated and people suffering. I'm sure you'll hear more persons complaining. It's a tough decision, but we have to do the necessary to avoid us reaching the level that we are seeing in some countries where I don't want to mention as far as the negative impact of the corona.
And in terms of easing the coronavirus strain, you're a member of cabinet. You get to talk about also the Prime Minister also mentioned an agreement to provide income support to COVID-19 layoffs. Many persons have been sent home, don't really know what is happening. You know, you can't really put a time span on a virus, you know. So can you speak on the cabinet's decision to provide income support to COVID-19 layoffs, as well as the carte blanche on moratoriums by banks and other lending institutions?
Well, like I said earlier, all of us have to come on board and all of us have to understand what we are dealing with. And whilst I mentioned the utilities, WASCO and Lucia, there are other organizations, like you mentioned, the banks who have given support to the programs and policies that we are implementing. You're quite aware that the Prime Minister have made a commitment, our government has made a commitment to give support to our persons who have lost their job. As far as the amount, I'm not in a position to discuss, but all I can say that we have given a commitment. People say it's the high time we make the announcement, but it's time. We don't want to go and make an announcement without engaging the respective organizations to make sure that whatever that we are proposing, that they're on board and they understand and they give support. So right now we are in discussion mode. As far as agriculture is concerned, we have our proposals, right, as to how we believe that we can support our farmers. And I'm not in a position to make that announcement now because we have not finalize the agreement, the package as it pertains, but very soon we will. The question of discussion, the question of limited resources, and I'm hearing a lot of figures being bounced around, right? Rightfully so, because if I was in that position, I would bounce around figures too, right? Without being responsible. So I have the fullest confidence that we'll stick to our commitment, and I mean, as a government, whenever we make a commitment, I can say we have stuck to our commitment. So it's a matter for us now to finalize our discussions with the respective, like today, we are meeting the unions, and that's critical, right? Meeting the unions is critical. I mean, they have to come on board. We don't want to go make an announcement and next thing the union say they're not supporting it. So before the weekend, and the Prime Minister would make the announcement as to the package that he intends to propose. Okay. Yeah.
On another note, as an MP, as a man on the ground, what has your experience been in terms of persons adhering to the legislation that has been imposed recently? What are your thoughts on it? The Prime Minister chided the public, some members of the public, for not complying, and of course tighter and tighter restrictions were placed as a result. We saw the local transmission established of the virus. Can you just comment on some of what you have been witnessing on the ground?
Well, and that's where we are today, because we are not happy that, and like I said at this point in Juba, not every St. Lucian, but some St. Lucians are not understanding and appreciating the policies and what we are doing, all right? And that is why when we first started, we started from 11 o'clock in the night, 11 p.m. to 5 in the morning, all right? What we saw, people not adhering. We say, okay, let's move from 8 o'clock, the same behavior. And the mere fact that some St. Lucians are not adhering to the policies and not following the instructions that has been given, we have to be tough. Unfortunately, there's some saying Peter pay for Paul, right? And that's the situation that we are in. We're hoping that at least we'll not have to look at more drastic measures moving after the 7 days. But the behavior of some St. Lucians, I'll not say all, some St. Lucians is not very encouraging. As a government, we need to put in place the respective measures that we can protect the majority of St. Lucians. And that is why we are where we are today with the 24 hours lockdown. We were comfortable with the 11 to 11 to 5. We went from 11 to 5 to 8 to 5, and still we're not getting the support for a number of solutions. So we think we reached a stage where we had to take that decision.
Okay. As we wrap up, I want to just backtrack a little bit. The farmers who have their produce, it's not just registered farmers who can sell to
No,
the marketing
any farmer who have harvested and they want to capitalize on this opportunity can go to marketing board this afternoon from 1 o'clock between 1 and 4. Of course, social distancing would be implemented, but the marketing board will purchase that produce if they so want to. Of course, it has to be of good quality.
Okay. Any final words?
Well, I just want to say thank you very much for giving the opportunity to speak to our farmers. I want to tell them that they have a responsibility in the environment that we are in right now to continue to provide for St. Lucians. Whilst we have put in policies in place, we are taking them on board, and we are trying to accommodate as many farmers as possible. They have that responsibility to get the legal instrument that they required through the Ministry of Agriculture, so they are allowed to move around and within that 7 days. Today, the police, based on discussions, would at least be a little lenient, but come tomorrow after around this time, we will enforce the law. So they have between today and tomorrow morning to get that legal instrument. Of course, from time to time we'll be engaging them. Those farmers that we know that we would need for them to harvest, we would inform them. Of course, and we give them the necessary pass to allow them to harvest. Okay, and of course for them to be able to market through the Central Marketing Board. So what I call is sacrifice time. All right, it's a tough decision.
Belt tightening.
But we need to do what we have to do to prevent ourselves from going through the negative experiences we've seen in other countries. So I'm asking for the support. On behalf of the government, I'm asking for the support of St. Lucians. We have written today to try and remedy the situations that and the complaints. So those who have genuine complaints, there are systems in place for them to be able to express these complaints and for us to see how we can improve on our deliveries. So I want to say thank you very much, and let's hope that we do not find ourselves in the situation that we see in some of these countries are now experiencing. So thank you for this opportunity.
Minister with responsibility for agriculture, fisheries, natural resources, and cooperatives, Minister Ezechiel Joseph. Thank you so much for joining us. That's all the time we have for now for this segment. Do stay tuned. You're watching the COVID-19 response here in the command center of the studios of the Government Information Service. Coming up, police are seeking out persons for illegal port entry from Martinique. You don't want to miss this. Stay tuned.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Welcome back to the COVID response here at the command center of the studios of the Government Information Service. My name is Jessie Leonce. Thank you so much for joining us. Of course, we know that persons have been commenting in the Facebook Live. Of course, we would like you to like our Facebook page, the Government of St. Lucia page, so that you will always know when we upload new videos, when we go live. And thank you for the comments that you've been making. Of course, we've been referring to them and asking questions as we go along. If you've been sitting with us from the beginning of our broadcast, you would have known that we spoke to Mrs. Natasha Lloyd-Felix. She is the Director of the Bureau of Health Education at the Ministry of Health and Wellness, and she was going over the hotline 311. Persons can call that number to get information about the coronavirus pandemic happening globally and in our neck of the woods. For those of you who are not aware, we have 13 total COVID-19 cases diagnosed in St. Lucia within a fortnight. And the government of St. Lucia has tightened restrictions on the general public to ensure that the rate of transmission is significantly reduced. Of course, we saw a curfew that was 11 to 5, and then the curfew was increased from 8 to 5 on the evening. And right now we have the full national shutdown, this drastic measure to curb the rate of community spread. The 311 hotline, you can call that number for relief packages. Some of you, I know, were caught off guard when the Prime Minister made this statement yesterday that the nation was shut down. We understand that some persons were not sufficiently prepared, and so the government of St. Lucia has made the requisite accommodations to help in that regard. And we want you to call if you are in need. We want you to call NEMO's office, that is the hotline 311, to make a request. And when you do call the 311 hotline to make that request for relief packages from NEMO, you're asked to leave your name, including aliases, because if they come into your community, maybe your neighbors might not know you by your, as we say, quote-unquote, government name, but you could also include your aliases and the specific address where you live and your phone contact numbers. NEMO will be preparing these packages. NEMO is preparing these packages right now. Speaking to some of my colleagues who have visited, they're saying that it is very hectic. Persons have been calling and packages are being prepared as we speak. Within the next 24 to 48 hours, persons are being assured that they will receive their packages to ensure that their households are not without during this 7-day shutdown. The NEMO will be preparing the packages, as I mentioned, which will be distributed by district disaster committees. Right? These committees will then be facilitating the delivery of these packages to individuals whose contact information has been given to the 311 agents. And I want to make an appeal. If you are curious, you do not need, you have been purchasing items and stocking up on food supplies and so on for an event like this, please, we discourage calls of curiosity on the 311 hotline. It is for persons calling to get information about the coronavirus, persons calling to get information about where they can go if they feel that they may be ill, they may be unwell, the measures they can take in their own homes, and if they want a relief package. If you are just curious, if you don't really need it, do not call the lines. We've been getting reports of inundated lines, and as a result, people who really need the help cannot access the individuals to help with getting these packages. So that's that on the 311 hotline. We're winding down on this broadcast, but I want to let you know that coming up we have the Acting Commissioner of Police who will be sitting with us, as well as an inspector from the Marine Unit, the Marine Police Unit, to talk to us about the recent boat that was recently seized and the ongoing search for passengers of that boat who illegally entered St. Lucia coming from Martinique. So we're going to hear from the Royal St. Lucia Police Force on that situation in just a moment. And they're also going to be talking to us about the measures that have been put in place from their standpoint in terms of ensuring law and order during the national shutdown. We want you to stay tuned. This interview will be coming in about an hour's time, so we want you to stay tuned to GIS. It is your number one location, number one channel for factual information that you can rely on. We don't want you to go looking for information through WhatsApp messages. That is not reliable, especially in this time of a very serious time, a very grave time for St. Lucians and the rest of the world. It's not a matter that we should be toying with, and we should be should approach this with a level of seriousness. And so we want you to tune into the Government Information Service. If we're not live, we are doing reruns to provide persons who did not get a chance to watch the broadcast earlier to watch and to keep abreast of what the government of St. Lucia is doing to ensure that everyone in the country is safe and sound amid the coronavirus pandemic, the global coronavirus pandemic. And just to give you statistics for the moment, 13 total COVID-19 cases diagnosed in St. Lucia within the fortnight, and this has concerned the government officials, the Ministry of Health, the Chief Medical Officer, to the point that a national shutdown has been put in order, from regular curfews, from the partial scaling down of non-essential economic and social activities. We have the call-in 311 hotline for relief packages and COVID-19 information. And just to give you some more tidbits, Cabinet has agreed to provide income support to COVID-19 layoffs. So if you are in a situation where you had been laid off because your company could not operate under the partial scale down or under the national shutdown, then you have the opportunity to benefit, your family has the opportunity to benefit, get some relief in this time. The Prime Minister is also speaking about carte blanche moratoriums on principal and interest loan payments. We will be providing you with more information on that assurance that he has given, having made that agreement with lending institutions and banks and other lending institutions. Also, WASCO offers free reconnections, no disconnection for 3 months. So if you are concerned that even if perhaps after this national shutdown is lifted, maybe Tuesday, Wednesday, you're concerned that you may be disconnected, you need not worry. WASCO will be making no disconnections for the next 3 months. And of course, if you have been disconnected before the period of this national shutdown, you can be reconnected for free. It's all in an effort to ensure hygienic practices during this time. The first quarantine group has been cleared for discharge this coming weekend. So the over 300 persons who have been quarantined, we will be seeing this weekend the first group being discharged. They have been cleared for discharge. And also we have news of the Cuban Medical Brigade dispatched to St. Lucia to fight COVID-19. Quite a significant event to happen between the two nations. Notice, and one more notice, farmers contact Agriculture Ministry for export arrangements. If you are a farmer and you have produce and you have nowhere to sell it, you were as well caught off guard by the national shutdown announcement last night. You have an opportunity to sell your produce today. You could just go on our Facebook page to get more information. We will be providing it there. And do stay tuned, because coming up in just a while, we will have the Royal St. Lucia Police Force representatives here to speak to us about the boat that was recently seized, and the police who are seeking out persons for illegal port of entry from Martinique on that boat. So do stay tuned. My name is Jessie Leonce. I will be coming back right on here. Do stay tuned. This is the COVID response, St. Lucia's COVID-19 response from the command center of the studios of the Government Information Service.
Wash your hands. hands, wash them before
eating or handling food or caring for infants, sick or elderly people.
wash your hands, wash them after
Using the toilet, touching raw meat, handling pets and livestock, playing outdoors, cleaning or handling waste and garbage.
wash your hands, wash them often.
You are going right when you make a habit of washing your hands several times a day.
This message brought to you courtesy the Bureau of Health Education of the Ministry of Health